I'm Lindsay. I'm going to be performing your head to toe physical assessment today. So if at any time you notice any discomfort or you have any questions, feel free to stop me in the middle. And I guess we're going to go ahead and get started. Are you comfortable?
Yeah, I am.
Very good. Is the room temperature okay for you?
It is.
Perfect. All right, I'm going to start by washing my hands. And then we're going to start with your vital signs. Okay. And take your temperature. Very good, 98.8. Next, I'm going to take your blood pressure. Okay. Blood pressure is 118/70. And next, I'm going to check your pulse and your respirations. Alright, pulse is 80, respirations are 18, and they're even and unlabored at this time. Okay, so next we're going to move on. Move this out of my way. I'm going to be assessing skin throughout the head to toe assessment, but from what is exposed right now, I'll go ahead and check skin, both face, neck, upper and lower extremities. Skin is pink, warm, dry, and intact with good turgor. There's no edema, lesions, or wounds noted. And next we're going to move on to neurological. Okay, I'm going to ask you a few questions. You may think it's silly, but just bear with me, okay? What is your name?
Dallas Christopher Clark.
Okay, Dallas, where are we?
In a clinic.
Very good. What year is it?
2016.
Very good. And what are we doing here?
Having my health assessment.
Very good. So the patient is alert and oriented to person, place, time, and situation. Patient's Glasgow Coma scale is also within normal limits at 15. His affect is appropriate and normal. As far as our conversation, it's also appropriate so far in the assessment. Next, I'm going to check your facial muscles. So I want you to look at me and smile. Very good. Smile is even. I want you to clench your teeth for me really tight. Very good. Now I want you to puff out your cheeks. Excellent. Now stick your tongue out. Move your tongue this way. And now this way. Very good. So as far as facial structures go, cranial nerves 5, 7, 9, 10, and 12 are intact. Okay, now I want to have you close your eyes and you tell me when you feel the sensation and where you feel it, okay?
Okay. On my right leg.
Very good.
On my left arm.
Very good.
Right hand. Left foot.
Excellent. So sensation is intact in all 4 extremities. Move this out of the way. Okay. Next, I'm going to have you go ahead and just open your mouth for me, really wide. Very good. Can you stick your tongue out? Okay. Go ahead and put your tongue back in. Just going to kind of look at your lips. Very good. Going to kind of peek up your nose. Excellent. Mucous membranes appear to be pink and moist with no lesions noted. I'm going to up here and look at your eyes. Okay. Eyes are symmetrical bilaterally. There's no redness or drainage noted. Next, I'm going to go over, well, actually, as we've gone through the assessment, his hearing has proved to be intact just through interaction during our conversation. We checked visual acuity prior to the assessment with the Rosenbaum chart at the appropriate distance. He covered one eye. His left eye was 20/20, his right eye was 20/20, and then both eyes together were 20/20 as well. Next, I'm going to check his cardinal field of gaze. Excuse me. I actually put this up too soon. Okay, I'm going to have you follow the tone depressor with your eyes. Try not to move your head, okay?
Okay.
Very good. Cardinal field of gaze is intact. That's cranial nerves 3, 4, and 6. Eye movement was smooth with each look. Next, I'm going to check his pupillary reaction. Okay, so I want you to just look straight ahead at me. Very good. Very good. Pupils are round. They react to light and they're accommodating bilaterally. And then lastly, I'm going to check his corneal light reflex. So one more time, I'm going to have you look straight up here at my finger.
Okay.
So corneal light reflex is intact and equal bilaterally. Next, I'm going to move on to the respiratory system. So I'm going to be checking your lungs. The first thing I'm going to do is I'm just going to palpate your lungs, so your chest and your sides and then your back, okay? As I said before, his respirations are even and unlabored. Very good. Come on to your back. Okay. There's no edema or crepitus noted upon palpation. Next, I'm going to auscultate. Take some good, nice breaths for me. Excellent. I'm going to come around to the back. Now I'm going to listen laterally. Okay. Respirations are even and unlabored, regular rate and rhythm. They're clear and equal bilaterally in all lung fields. I'm actually going to check your trachea. Can you go ahead and swallow for me? Very good. Trachea is midline with no deviation noted. I'm going to have you take a big deep breath while my hands are on your back. Excellent. And one more time. Okay, chest expansion is symmetrical as well. Next, I'm going to move along to the cardiac system. I'm going to start with his pulses. I'm actually going to auscultate the carotid pulses one at a time, of course. And I'm actually going to have the patient hold his breath while I do that. So I want you to take a big deep breath and then hold it for me. All right, take a breath. Do it one more time. Excellent. Okay, now I'm going to palpate those carotid pulses one at a time again. Excellent. Pulses are normal, regular rate and rhythm, with no bruit noted. I'm going to check your pulses in your arms and your legs. So if you'll just kind of hold your arms out, both bilaterally and simultaneously. Okay, that was the brachial. It's the radial. I'm going to go behind your knees here with my hands. You just relax, just like that. This is the popliteal. Okay, I don't know if you can see down here, I'm on the top of his foot. That's the dorsalis pedis. And on the back inner part of the foot is the anterior tibialis. Okay, while I'm down here, I'm going to actually pinch on your toes and notice the color change in your toes. Checking for capillary refill. And lower extremities, it's less than 3 seconds. Okay, I'm going to have you hold your hands out for me. Very good, just out, just like that, perfect. I'm going to check capillary refill. Alright, capillary refill is less than 3 seconds in both upper and lower extremities. Next, if I had the appropriate bed, I would lay my patient back to a 45-degree angle and observe for any jugular vein distension. But since I don't have a bed that will cooperate with me, I would have to lay my patient flat. So just know that if I had the right equipment, I would be doing that. And next, I'm going to go on to check heart sounds. I'm going to listen to all heart sounds with both the bell and the diaphragm. I'm going to start with the aortic. Then move to the pulmonic. Then the herbs. And the tricuspid. And the mitral. Okay. Excellent. Heart sounds are strong, rapid, and regular with no murmur noted. Next, I'm going to actually have you lay down flat with your head down here. I'm going to move this out of your way. And I'm going to listen to those same heart sounds with both the bell and diaphragm again with my patient laying down this time and make sure there's not any changes. Again, heart sounds are strong, rapid, and regular. There's only 2 sounds noted, both sitting and laying, and there's no murmur present. Next, since you're already laying down, I'm going to go ahead and inspect your abdomen. So can you pull that down up for me just a bit? Thank you. I'm actually going to inspect from both sides. I'm actually going to get down on your level and look. Excuse me. Lower this side, do the same thing. There's no masses, edema, or pulsations noted in the abdomen. Next, I'm going to auscultate his abdomen in all 4 quadrants. I'm going to start in the right lower quadrant. Lift up to the right upper quadrant. Now the left upper quadrant. And now the left lower quadrant. Bowel sounds are normal, active. There are clicks and gurgles present in all 4 quadrants. Next, I'm going to move on to palpation. I will start with light palpation and then move on to deep palpation. So at any time while I'm pressing on your abdomen, if you feel any tenderness or discomfort, please let me know.
Okay.
Okay, we'll start with light palpation. There was no masses or tenderness noted with light palpation. Now I'm going to move on to deep palpation. Excellent. There were no masses or tenderness noted upon deep palpation as well. Very good. I'm going to let you sit up now. Okay, if you'll swing your legs around this table towards me. Okay, I'm going to have you stand up on the floor. Very good. I'm going to have you walk around the table and then walk back to me.
Okay.
Very good. Now have a seat back on the table. I was assessing the patient's gait. It was even, coordinated, and symmetrical. Muscles and extremities are appropriate size and strength. Throughout the exam, I've noted appropriate range of motion in all joints. And next, I'm going to check your strength. So I need you to hold your arms up like this for me. Very good. So I want you to pull against my hands. Excellent. Now I want you to push against them. Very good. So strength is present in the upper extremities. Now I want you to pull your legs against my hands. Very good. Now push against my feet. Excellent. While I'm down here, I'm going to check for clonus. I haven't done that yet. Very good. Excellent. And so reflexes are appropriate. Now I'm going to check for your radial reflex. I don't have a reflex hammer, so I'm going to use my stethoscope. Okay, so there it is. Perfect. There it is. Okay, I'm going to check the popliteal reflex. There it is. Alright. Reflexes are intact in both upper and lower extremities. And that concludes our head-to-toe assessment. Do you have any questions about anything? Thank you so much for your cooperation. And again, my name is Lindsey Clark, and this was my head-to-toe physical assessment. Thank you.